Council of Minority Transportation Officials, North Texas Chapter President. Right now, we're celebrating COMTO Week. We're in the middle of it, not even in the middle. We're on the back end. This is day 4, and day 4 for COMTO North Texas. We're celebrating or identifying health risk and preventative health options. So those performing at a high level with busy lives, being stretched thin. We have to take a step back and identify some preventative health measures. And with that, we have joining us men's health expert, Dr. Ahmad Garrett-Price of GP Health here in the North Texas area, although he'll be coming to us from Atlanta, Georgia at Morehouse College. And also women's health expert, Dr. Jessica Shepard. You might have seen Dr. Shepard on many national platforms, to the Today Show, Good Morning America, and so forth. She also has her own practice called Sanctum Med and Wellness, also in the North Texas area, but you could catch her pretty much around the country doing talks, traveling, and media appearances. All that said, let's get ready to get started, and I will let Dr. Ahmad introduce himself. Dr. Price?
Yeah, so my name is Dr. Ahmad Garrett-Price. I am now president and founder of GP Health, which is a proactive and preventative health practice and service. I'm originally from East Texas, attended medical school at UT Southwestern, did my family medicine residency in Conroe, subsequently was out at Kaiser Permanente for 5 years and matriculated back to the area and ran a private practice that was more of a personalized approach as well at Baylor Scott and White, and just kind of spun out and started my own venture. And I've been in primary care in this area for 12 plus years, and it's become apparent to me that we probably need to take a more upstream approach to health. And what I mean by that is really doubling down on lifestyle and healthy habits to really prevent, but also better manage disease and to optimize health. Just from where I sit as a treating physician, that appears to be the more sustainable approach here. So those are my ethos as a clinician. I'm also involved in, civic health. I'm on the DeSoto Economic Board and kind of serving as a health czar for programming healthy communities, if you will. At Morehouse, we have an initiative here for, those who want to continue on the path to clinical care, but also giving them insights into, the changing landscape that is healthcare. So a lot of things happening, but a lot of good things happening. And I'm just kind of honored to be here today. And Marvin, thank you for inviting me. So
perfect. Thank you for joining us, Dr. Price. So let's get ready to jump into the questions. So first of all, this is pretty much a laid back format. Doesn't have to be uptight or anything. So if you have questions with respect to some of the answers or just some health issues and concern that you might find personal that you want an answer to, please drop it in the chat or raise your hand or your digital hand and we'll get that answered for you. And that applies to both Dr. Price and Dr. Shepard once she joins us. She's going to be a little bit late due to some commitments on her end. All that said, we have a couple of pocketed questions we'll get to. I want those both answered from like the male perspective. Dr. Price been a male health expert, and Dr. Price with the women's health angle also. All that said, we also can answer in a general format, and if we need to delve deeper, we can do that also. And then I'll probably ask some of the same slotted or pocketed questions that I'm asking Dr. Price. When Dr. Shepard joins us, we'll ask her some of those same questions also, so it won't be so we won't leave anyone out. And again, if you have specific questions, drop those in the chat or raise your hand. All that said, we'll get ready to get into some of the pocketed questions that I had prepared. And this one will pertain to family health history, Dr. Price. What precautions can we take for family health history? I mean, if we know some of the issues or not, heart disease and what have you, what are some precautions we can take with respect to family health history if we know about them and not in our busy lives? Is that something you can help us with?
Yeah, so that's an excellent question because that's kind of how everything starts, right? And so I've told you my approach is more proactive and preventative. So right off the bat, I would say, whether you know your family history or you don't know your family history, you definitely want to make an effort to be seen by a healthcare, right, professional, physician, provider at some point throughout the year, at least one visit or two visits. And the reason why that's so very important. I can't tell you how many times that I've, seen someone and say, hey, I haven't been in the doctor in 2 or 3 years. We look under the hood, if you will, in terms of labs and diagnostic studies, and we see something that we won't want to see. All the while where that actually could have been prevented or we could have intervened a lot sooner. So I think it's important to just really get your annual labs, your annual physical exam. So, from a physician perspective, what that helps me to do is really start to pick up on trends, right? Get your glucose screen, get your cholesterol screen. And if we're starting to see some different things, we can obviously intervene or make and that to become a profound issue, right? And I would say in terms of family health history, I do acknowledge that at times, some individuals may not know their family health history, but I would say if you do know your health history, start to make note of that because that starts to cue you into the things that you want to pay attention to. For instance, if you have a history of diabetes, a history of hypertension or cholesterol, heart disease, well, now we know when you come to the physician, these are the things that we should screen for. But also these are acquired illnesses, meaning that we usually acquire them based on how we live our daily lives. So you can start to say, hey, I probably need to eat this way. I probably need to exercise a little bit. I mean, make sure I'm getting proper rest. So you can really start to stay on top of that from a preventative perspective. And then I would say the second layer of that is if you do know your family history and there's a history of colon cancer, history of prostate cancer, history of breast cancer, these things can be detected early. So I would recommend, hey, early screening, early detection, so one can intervene early. And also, I'll just throw a little nugget in there of if you do have a family history of a certain condition, you can start to meet and do genetic counseling and genetic screening very early. So there's a number of ways to approach it, right? So if I don't know my family history, I just need to be getting seen and getting my labs checked. So if the doctor picks up on anything, they can follow it to the end. And if I do know my family history well, if they're acquired illnesses like diabetes and hypertension, let me just start by getting myself screened and checked for those things. But if there's very specific conditions, bam, we can start to dial in and say, hey, maybe you need genetic counseling. Maybe we need to start screening you earlier than what we would screen someone normally because you have a family history. So a number of ways to engage, but they all revolve about being proactive and preventative in your approach for sure.
Okay, Dr. Price. So inside of that is a couple of follow-up questions or spinoffs that I kind of had. So with respect to when some of those tests should start, those preventative tests, when is a good time and based on age range, right? So we have some young professionals joining us, 25 to 35, 35 to 40. I myself in the 35 to 45 plus 5 range. I'm almost 50 now. So when's a good time to start some of those tests, kind of like you were talking about? So give us an idea when we should look into jumping and start those.
I would say 18, honestly. 18 to 21 is when you want to start being screened for these things. And maybe you're not screening annually for certain things, but in general, if you look at the recommendations, when you start getting that 2021 age, that's when you definitely need to, hey, let me see a doctor. Let me have my cholesterol, my glucose screen. Let me look at my electrolytes and my blood counts, et cetera. So 20s to 30s, that should be an annual endeavor for you and something that you do. Much like you go to the, if you're able to, you go to the dentist and you get your teeth cleaned once or twice a year. Same thing applies to your health, right? I like to think of, not that we're cars, but you think of the body in terms of a car. It's better to keep the maintenance up on the car instead of waiting until it breaks down and take care of the car. And then I would say in our 30s to 40s, same thing, annual screenings. But at this particular point, when you start to say, oh, I have a family history of breast cancer, all right, well, maybe my mammograms need to start in the 30s. Or I have a family history of prostate cancer, all right, well, maybe I'm considering a PSA in my late 30s. Or colon cancer, okay, I'm aware of that. Maybe I need to start to think about talking to a gastroenterologist. And then definitely in your 40s is when most of these, yes, you need to be getting your normal annual labs consisting of electrolytes, sodium, potassium, et cetera, your cholesterol, your glucose, but you also start to really do specialized things like a PSA, like a colonoscopy, right, for screening for colon cancer, like a mammogram. And for the women in the audience, and I know Dr. Shepard can speak more to this, but I think the guidelines are definitely, early 20s. We start looking at pap smears every, 2 to 3 years. And based on what they find, the recommendations clear out. If you do have a family history of breast cancer, you can start to look at genetic testing in your 20s and 30s, right? BRCA1, BRCA2, and then consult with your obstetrician in terms of when's the right time to start, your mammograms. So I know that may have been a bit long-winded, but I hope that helps to provide some insight there.
Awesome. Not long-winded at all. Let me let Jimmy in. All right. Okay, I think we got some background noise. Mr. Jimmy, we need to mute you. All right. We got that taken care of, and now you've kind of taken the spot of the presenter. So we'll get that worked out. All that said, thank you for that. So a follow-up to that, focus around workforce and the shift to kind of our present mode of like this work from home hybrid workspace model. What are doctors seeing, or what are you seeing specifically, if you got any patients coming in arising out of that? I mean, given the fact that we're coming into this new work from home hybrid model, we're not as mobile as we used to be, right? We're sitting down. I mean, even now we're sitting in front of this two-dimensional screen, kind of interacting with one another. What do we look for? What are you guys seeing? I'm sorry. What are you guys seeing nowadays with respect to the lack of mobility that we formerly had, whatever mode of transportation? We get up, get out the house, go to the office, walking around the office, interact with one another, walk to lunch. We don't really have that anymore per se. But with this new hybrid workforce model, what are you guys seeing specifically to like mental health, or, something superficial, or even something internally that we're seeing as a development from this new work from home hybrid workspace model? Can you kind of dive in on that a little bit?
Yeah, so that's an excellent question, because I think, this remote hybrid work environment is just going to be part of our existence moving forward. So, I think we're still in the early innings in terms of seeing actual data as to what is being caused. But I think my observations with my own members and my own patients and just what I'm seeing are really twofold. One, I've kind of broken it down, right? Like, I think it was great that, we were able to work from home. We were able to be efficient, right? We were able to take our, noon meeting from our couch and our kitchen tables. But at the same time, home has become work, work has become home. So it's this hybrid environment in the truest sense of the word. So initially, I think about physical health, right? So to your point, Marvin, is, all right, I'm working from home 8 to 10 hours a day. I'm probably not getting up. I'm probably not moving. I'm still, consuming the same amount of calories that I was consuming before. If anything, I've seen schedules get busier in a work from home environment, and that people are actually, back-to-back meetings all day. So what happens is we, whether we meant to do it or not, we've essentially put ourselves in this very sedentary lifestyle, right? So your physical health to a certain degree starts to suffer. So we see increased BMIs, cholesterol, glucose numbers are coming up, and people just are not getting out. So, to kind of mitigate that, I would certainly say, much like you would do if you were going to a work environment, try to have frequent breaks in the day. Try to get up, walk for 15, 20 minutes. 15 minutes of physical exercise can keep a heart attack away. We've proven that 150 minutes a week. So you almost have to be more intentional about separating things and getting yourself and being active, which brings me to the next point in that, I start to think about mental health, right? Just like I said, the couch and the kitchen table is where you take the meeting from. Well, it's also where you eat. It's also where you rest. I start to think of, musculoskeletal things, right? We're all hunched over on a computer most of the day. So you think about your ergonomics. So you have to be very intentional, much like when you're at work, you wouldn't eat, sleep, cook, and stay at work all day. So you probably shouldn't do the same with your home environment. So I would recommend, hey, let me break up the day and have a 5 to 10 minute break between these meetings. Let me get some what I call sunlight therapy, get out, walk around. let me change the vantage point some days, meaning like, even if you are able to work from home per se, maybe we're at a quiet coffee shop. Maybe we go to a co-working space. So you have to start to really separate home from work, because right now it looks like this. And inevitably, think about it, you would not stay at your work physically 24/7. So the same thing happens with the home environment, to the point to where I would say be intentional and just like get up and leave if you've been there all day. And like I said, just brisk walks and really taking care of your mental and physical health, so they don't suffer as a result of this new kind of hybrid sedentary work environment that is, been created probably unintentionally, but there are some health effects that we're starting to see in the realm of physical and mental health. So,
All right, very good, Doctor. Dr. Price. So one last question for you before we open it up to general questions. Like I said, you guys can put it in the chat. What are 3 misconceptions about health, like preventative or maybe just health in general? What are like 3 misconceptions? You can make it specific about men's health, but you can also just go in general to apply across the board. But basically, what are 3 misconceptions about health?
I think the first is, which to me is that it's not attainable and it's unachievable. So that's the first thing I think. The second thing I think of is that it's expensive, right? Like it's going to be costly and expensive for me to be healthy, and we'll debunk these one by one. And then the last is that, health, my health looks like the next person's health. And what I mean by that is, to me, health is a very personal journey, right? What is healthy for a 64-year-old diabetic who was previously overweight, has now lost 15 pounds, and their sugar levels is getting controlled, is vastly different than what health means for you or myself. So the first thing to do is really recognize that health is really a fraction or a construct that is very personal. It's like a personal walk. So it's not what you see in pop culture. It's not what you see on social media. It really is what it actually means to you. So, that could be, hey, I want to lose 10 pounds. Hey, I want to start to eat like this. Hey, I want to exercise like this. So make health very personal to you, so it doesn't become this myth and this unattainable thing. And then I would say the whole expense thing. So in my own health journey, I'll use myself as an example. Grew up in East Texas. We're big on meat and potatoes and a lot of seasoning. It's great. We border Louisiana. The food is good, et cetera, et cetera. But also, as you age, that type of diet will lead to some underlying health issues. So, people always say, oh, it's expensive to eat healthy. Don't get me wrong. I've seen how much the organic blueberries cost now. They are more expensive than they used to be. However, they are still cheaper than processed foods, or if you're going to eat steak and, processed foods, processed meats every single day. Trust me, the fruits and vegetables will still be much cheaper in the long run. And when I say it's cheaper, it's also cheaper on you not having to come see folks like me and Dr. Shepard, although we want you to see us because our mode is different. But what I mean by that is you're not always at the doctor's office spending money and time there. And then, like I said, the fact that it's not attainable, I have for myself what I call like a 1% rule, meaning that 1%, you just get better every day. So if it's something you want to work on in diet, all right, substitute that meal out, eat that salad that day, or start the morning like, you know what, I'm going to have a green smoothie, I'm going to eat an apple. So just small changes lead to big changes over time as long as you're consistent. So those are some of the myths that I've seen and try to debunk even in my own practice, is that, hey, we just take little gradual steps to get to where we want. We make a goal, we achieve that goal, we make another goal. It's consistency, but also just saying, hey, my health is a very personal thing. You may not look like the fitness model on Instagram. You may not look like this image that is being put in front of you every day. However, health to you is personal as long as you're not getting ill, getting sick, and keeping yourself, and having good daily health habits, then health is achievable for you for sure.
So even for a point of clarity, Dr. Price, even the Instagram models themselves don't look like Instagram models, right? They're a bunch of filters and
This is very
airbrush and
true.
this. on top of those. All that said, there is a question inside the chat. We have opened it up for questions to be asked. So if you could take a look at that, if you can see it, it's quite lengthy with a little background story to it. So you take a look at it and then respond accordingly. Can you?
Let's see. How can we, particularly as a community, be aware of properly navigating ourselves to combat medical treatment? So I did a whole podcast about this, and my brother is a cancer survivor. So this is a issue that's near and dear to me, and so I should say we know that there are discrepancies and there are biases in the healthcare community. The data shows that that's not just Dr. Garrett-Price's opinion, right? So what I have this concept, and I'll use my brother as an example without his permission, but I know he doesn't mind because this story will help others. And I remember when he first got diagnosed with his cancer, and, I'm a physician, but I'm not the physician that goes in the room and is like, hey, I'm a physician. We need this done. I tend to, observe and look at things. And so I remember going to one of his first visits. I remember the physician just really talking at him and not being really collaborative in their approach. And it actually made me angry while I was in the room. I was angry at the physician, but I was also kind of angry at my brother. And maybe I shouldn't have been, in hindsight, for him not understanding the dynamics. But then it made me reflect back. It was, well, okay, he has a family with medical professionals and he has insight into this. And so how many other times has this happened? I say that to say that what we did was we came back with questions. We said, we're going to understand this, and we want you to explain this in the way that you understand, or that we understand it when we walk out of here. And so, yes, unfortunately, it takes some time and effort to do that. And I understand that sometimes information is limited for certain communities to access. But this concept of being an activated patient, where you go in, you have questions, you make sure things are clearly explained to you. This for yourself becomes self-advocacy. Take notes on the visit. But that is a way to start to disrupt bias and not let the bias happen to you, right? So when the bias is happening, you're just receiving it, then it's more likely to, in times, lead to a poor outcome. But if you come in and you say, hey, Dr. X, I need to know this. What do you think about this, right? Can you explain my treatment plan to me? Can you explain these medications? All of a sudden, you start to disrupt that just a little bit. So I know that's more of a lengthy answer, but we were able to get better results, right, when we took that approach. So being an activated patient, taking notes, and unfortunately, you should be able to receive this care without having to do all these things, but that's just not the reality, right? We know that. So I would encourage everyone to be what I call an activated patient, and really participate and take a more collaborative approach in your care. So you're not being told, instead you're being collaborated with. I hope that's helpful. And don't feel bad about taking a friend or a family member to a very complex visit as well. Sometimes they will hear things that you don't hear, and it helps to have someone who cares about your health and well-being in the room at times, who can kind of assist in that process, if you will. So.
Oh, perfect. Thank you, Dr. Price. And for those of you who don't have access to the chat and may not have seen the question, it read, how can we, particularly as a minority community, be aware of and properly advocate for ourselves and combat medical treatment discrepancies in the clinical environment? As an example, a close friend without cancer in her family felt a small nodule during a self-examination. She had to go to 3 different doctors because one took her seriously, ordered appropriate tests, and she had stage 4 breast cancer. So point of it all, wrapping it up in the question, thank you for the response, Dr. Price, is how can we better advocate for ourselves and for our loved ones? Thank you.
And I will say this, just to add on that, I will say this: if you are ever in front of a physician and you feel like you're not being taken seriously and this is a real concern to you, certainly seek out another opinion. And I much like what you did, Miss Marquita P., you want to be in a place where at least you feel heard and seen and taken seriously. So kudos to you guys for working through that, for sure.
Oh, perfect. That brings up a question for me, actually, Dr. Price. What is the pathway from a general doctor's visit per se to a specialist? I know sometimes I have difficulties personally trying to get to a specialist for what my back hurts, or maybe a cardiologist. What does that path look like, for general knowledge, to get to a specialist for us?
Yeah, unfortunately, this fee-for-service insurance world has us jumping through a lot of hoops that we don't have to. So I'm not trying to offend anybody with that statement, but that's just the way it is. So what I mean by that is that some insurances, because it's all based on insurance, because in a perfect world, you should be able to just say, hey, I need to see this person. Let me go see him. So what is your insurance coverage, right? Does your insurance allow for you to directly take yourself to a specialist? Or does it require a referral from a primary care physician, which most insurances do? So your first stop, and this is why it's so important to be in lockstep in having a primary care physician, is that they know you the best. Theoretically, we refer to the earlier part of the conversation, they've been following you, they know your labs, they know your family health history, so they know and have the expertise to say, hey, you're having these symptoms, let me refer you to this specialist, and then they'll collaborate with the specialist. That's the traditional route, right? Now, some folks have insurance plans that I've noticed that allow them to self-refer to a specialist, which is also a route to go about getting yourself to the necessary line of treatment. However, I will say a lot of times when you go through your primary care physician, things have been teed up for you, so that's a more productive visit when you get there. But that's the traditional route. And then there's this world that Dr. Shepard and Dr. Garrett-Price live in, where it is less fee for service. We work off memberships and kind of cash-based service. So when you are working in that environment, there is the option to refer yourself to a cardiologist as long as you can pay the cash price for that visit, which, you know, is often cheaper than using the insurance. And that's a discussion for another day. But so there's several routes to do it. So PCP, referral, direct referral, or cash-based visit for yourself.
Perfect. Again, thank you, Dr. Price. That said, we have to bring in Dr. Shepard has joined the conversation, so we'll get ready to bring her in. I'm at a conference right now, so excuse me, people walking by and I'm waving at them. We'll bring in Dr. Jessica Shepard, join the conversation. She's joining us from Dallas, where she's at Sanctum Med and Wellness, her offices here in the North Texas area. Now we get to expand the conversation, get more detailed questions from our audience on women's health, and have Dr. Shepard and Dr. Garrett-Price continue the conversation. So right now, allow Dr. Shepard to introduce herself as I bring her to the stage. So I'm kind of rushing. Please welcome Dr. Jessica Shepard. Thank you.
Hey, how are you? Glad to be here. Thanks for allowing me to take part. Hi, Dr. Garrett-Price. Love being on a panel with him because we really do see health in so many different ways and what you're seeing in the healthcare system currently. So glad to be able to provide some insight today and looking forward to some questions. But if you wanted to go right to questions, or if you wanted me to kind of give any more background, that's fine too.
Perfect. Thank you. We'll go right into questions. So with that said, right now we're focusing on talking about high performance wellness, women in construction. This is, and we're also focusing on, if we go into a detailed question, say around breast cancer, something like that. When is the ideal, and this is something to ask Dr. Price also, when is the ideal time to start testing based on an age group for any routine testing for preventative health? So like the 20s, the 30s, and into your 40s and 50s and beyond. What is the ideal time to start, and what type of testing should we focus on and look at is the question.
Yeah, absolutely. So looking at the decades, we know with any disease process, namely cancers, most of them are going to be increasing your risk as you age. And I kind of like to give the context of our cells are amazing when we're first born. They're very new. They know how to replicate. But everybody has cancer cells, in the sense that we have cancer cells in our bodies, but our bodies, from an immune perspective and also from an age perspective, have the ability to turn off that cancer, that mechanism that turns cells into cancerous. So as we age, just from an aging process, that ability to do that decreases. But there are certain cancers that we do see have a predilection for a younger age group, namely breast cancer. And so what we do is, from the science side, from the nerdy side, what we do is we know those incidence of when that peaks, at what age that cancer usually peaks. And so for breast cancer, that's why we start our screening earlier at the age of 40 with a mammogram in order to detect any early signs of cancer. The goal with cancer, any cancer, is really to get it at an early stage. Now, every cancer doesn't always have a screening test, but breast cancer, we are very fortunate to have that screening tool of the mammogram, which starts at the age of 40. And then typically what you should do is get a mammogram every year. Now, what we are seeing is that there are certain cancers or breast cancer that are starting to come up in earlier ages in women. Usually that's going to be from usually a family history of that. So if you have a strong family history, namely you have a mother who was diagnosed with breast cancer under the age of 50, or you have a male, any male in your family that has breast cancer, males can get breast cancer. It's only 2% that you would see. But if you do have a family member, male family member that has had breast cancer, that immediately puts you into a higher risk. That's when you should start getting screening earlier, usually with an MRI or an ultrasound as early as maybe in your 20s or 30s, depending on that. So I would say that for the general population, age 40 is when you're going to start to see that screening, starting with the mammogram.
Thank you. Now, while I do have a couple of pocketed questions, we also have some, the chat is open for questions. And if you do have a question for Dr. Shepherd, you can take yourself off mute or just raise your digital hand and we'll get your question in there. All that said, Dr. Shepherd, I'll go to one of my pocketed questions. What are some of the top 3 items, or what are the top 3 items women can do for preventative health? What are the top 3 they can kind of jump out there and do now to kind of address their own preventative health measures? Did you catch that, Dr. Shepherd?
I think it's for GP.
No, that was for you. I previously asked Dr. Garrett-Price. The previous question, he answered that. That one was for you. Yes, thank you.
Yes, absolutely. For self-care, I really am doing your best to preserve your health in the long run, and that how you can do that is really paying attention to your health and wellness from an early stage. I say this the same way that I would tell someone about finances. I would never tell you to wait till you retire to start saving money. I would tell you to start early so that you have a pocket when you do retire. So the same thing with your health. We are all going to age. We really have the decision on how we would like to do that. So for women particularly, I would say making sure that at menopause and in the perimenopausal phase, which is in your 40s into your 50s, that we have a significant decline in estrogen, but estrogen really impacts very key organ systems in our body, such as the brain, bone, and the heart. And so that really has an increased risk, therefore, for people to have diseases with heart disease, with dementia, with the brain, and then also with bone disease, namely osteoporosis. So I would say that's one way that women can kind of change the conversation. What we've seen in the past is starting with hormone replacement therapy, but having a conversation so that you understand why you're going on hormone replacement therapy. The other thing I would say is heart disease. So heart disease is still the #1 killer of women, bar none. Can put any cancers together, heart disease still will rise above that. So taking care of your heart, that comes in the form of things that you can do with lifestyle. So that is incorporating exercise very early on, so that by the time you hit that 50-year-old time frame or menopause, decrease in estrogen, then you start to see heart disease, is that you've started to build up the system in the body to be able to get you in a very strong recovery mode. And then last, I would say, is an easy way to prevent cancer is cervical cancer, which is your pap smear. I know we may moan and groan about it, but it is such an easy way for you to be preventative, because early detection for cervical cancer is a game changer. Because not only can you treat cervical cancer in its early stages, you can actually cure. There's one of the only cancers that we would see that you can have something that can be cured. And we have the ability to do that when it is done in an early stage. So those would be the 3.
Perfect. Thank you, Dr. Shepherd. Right now, I'll go ahead and open up the floor in case there are any questions. I don't want to occupy all the time. Again, raise your digital hand. Just come off mute and ask the question. And if not, I'll keep going because, like I said, I have a slate of questions I previously submitted that I can keep going into. So if anybody has anything, you can just interrupt me. And if not, I'll just keep going. That said, Dr. Shepherd, I'm going to ask you a question. I also asked Dr. Price previously around the new hybrid work from home workforce or work culture. Is there anything women need to be aware or conscious or cognizant of with respect to their bodies or preventative health with respect to the new hybrid work from home, because we're not as mobile as we used to be. We're staying home now. We're home with the kids. We're living and working and functioning all out of the same space. Is there anything with respect to mental health, physical health, excuse me, that you're seeing in your office or that you see in the industry right now that we need to be aware of with respect to women and the new hybrid work from home concept?
Absolutely. I think that, and I hope Dr. GP has the same answers as me, but you kind of alluded to it with decreasing mobility. And that is one of the biggest proponents that we've seen across the decades in what is increasing our actual disease population is lack of movement and sedentary lifestyle. And so with the working from home, you now have this decrease in movement because you are not having to mobilize or get to work or utilize however way you were getting to work and then getting into the building and then having to move within your building. Those are actually small ways that a lot of times increased our movement. So I would say working from home is making a very concerted effort to take times in the day where you're moving. So some of the modalities that you can do is maybe have a standing desk. There are also some, what they're called, I can't remember what they're called. You can help me out, GP, if you remember, is they actually have these like step things that you can do while you're sitting at your desk.
Yeah.
Yeah.
A couple of my members are using what they call walking pads, and they're like these little treadmills that you essentially have in your home. They can be, 3-4 feet long, but it keeps you in motion. And that's one of the things that we hit on is like we have intentionally, I think it's great remote work, but certainly it leads more to a sedentary lifestyle. So you have to have these hacks for sure.
Absolutely. And I'm even a victim of that as well. But once you're more cognizant of it, I would say the best way to make it a routine, your brain is really smart, which is why it's the brain, but changing habits is very hard. And so initially you're going to have to set reminders. So set something in your phone that every 4 hours you're doing something, whether it's even standing up, stretching, mobilizing yourself, even just walking a couple of steps back and forth. The other thing that I would say is nutrition is one of those things that many studies have shown that the more sedentary you are, or the more that you're at home, you actually eat things that are not actually great for you because you snack just because it's available. So really evaluating what's in your fridge and your drawers, because if there are things that you can easily grab that are not nutritionally beneficial for you, then eliminating that from your house. So it's kind of like not seen and you're not going to eat it. And I would say the other thing is to then promote healthy nutrition by having snacks that are packaged for you that are healthy. You are more likely out of convenience to grab something that's readily available. So make the things that are readily available to you more nutritious. And you can do that with what we call food prep. So if you buy, a whole vegetable tray, then you can like mix that up into little baggies and have your vegetables ready for you to grab. You can do the same thing with fruit, or commit to, making your smoothies in the morning and adding the things that are going to be good for you in name of fiber, some protein, and then collagen as well. But really transitioning how you provide the things that are available to you so that all of a sudden that becomes your routine, and eventually you won't need those alarms in your phone to remind you to get up and walk. And then one more key thing I think is important is to, anytime you eat a meal, you're seeing significant impact. And if you just take 10 to 15 minutes to have a walk after you have your big meals, really helps with decreasing your blood glucose levels. And that's really helpful, again, for people, especially for women, how they store their fat is with glucose. And if you have less glucose around and it's being utilized, the less likely that you are to get diabetes, heart disease, etc.
Oh, that's awesome. I have a spinoff question that I have to remind myself to ask it with respect to the heart rate. That said, last night I was at a social event following an outreach at a high school. And at the social event, we had a table there were chicken fried wings, we had alcohol, some fried broccolini, different types of fried foods and alcohol on the table. That said, can both of you speak, both Dr. Price and Dr. Shepherd, if both of you could speak to how fried foods and alcohol affect the body as we age and what we can do in a preventative measure with respect to the fried foods and the alcohol, if you don't mind.
I'll let GP go first so I can, because I'm trying to have because you know how I am about food. You should know how I feel about fried food, Marvin. GP.
No, but I think you're right. I think Dr. Shepard hit on a point is that we have to make this a little more approachable and a little more convenient for ourselves. But in general, as we age, when we talk about fried foods, processed foods, red meats, etc., these have a heavy inflammatory burden, if you will, on the body. Inflammation often leads to disease, right? Especially when we start talking about cardiovascular disease, we start talking about, hyperlipidemia, high cholesterol, which the endpoint is heart disease. All these are inflammatory conditions. So theoretically, the saying that food is medicine is not just a saying, it's actually very true, right? So if we want the insides of our body to work well, be de-inflamed, et cetera, we need to put good foods into our body. And so fried foods, because of the way they were prepared and heat, are just giving off this and setting off these inflammatory cascades. So I would say this is something that, and I alluded to me being from East Texas on the border of Louisiana. I've had my fair share of fried food, so I make no judgment here. But at the same time, like where I come from, a lot of people think, oh, I'm going to get this because my mom had it or my dad had it. And I say that to say that you can completely change the narrative. So it's not that you can't ever have these things again. You just should not do these things routinely. This should be, few and far between. Otherwise, it should be whole foods, plant-based products to a certain degree, if that's your thing, right? And putting good, vegetables, legumes, produce. I have a thing in my practice where I say, drink your calories. And I think Dr. Shepard alluded to this, put it in a smoothie. Maybe there's days where that's what I do, more of a soup, shake, smoothies type of intake, but also, meatless Monday. So in which we do in our practice. So essentially, the end all be all is that these are inflammatory compounds. Chronic disease is caused by a lot of these inflammatory compounds that we put in our bodies, mainly heart disease, right? So if we want to move away from that, we need to put less of that in our body and put things in our body that allow it to work properly, but also allow us to age gracefully and avoid disease. So in this particular case, less is more.
Thank you, Dr. Price. Dr. Shepard, do you have anything to tag on to that?
But I would just tag on that, our bodies are machines. And so what we give it and allow it to be exposed to, it can only respond to that, right? And so aging is a big part of that. And as your body starts to have changes due to age, whether that's from a vascular perspective, how blood is utilized, how we store fat, how we store energy, it really will, over the course of time, start to decrease that efficiency of what it can do. But you do have the ability through nutrition, I really believe nutrition is medicine, to offset some of those changes that occur with physiologic normal aging. And so that's typically why we start to see heart disease and diabetes and high blood pressure impact us as we age, is because, one, the fuel that we've given our body, outside of family history, there are things, that family history that we can't control, but we can actually mitigate and decrease some of the impact of family history. But outside of that, the things that we have control over really can be changed and modified through diet and exercise. There's so much literature that states that. So if we look at ourselves as what is the best version of how I want myself to be in 10, 20 years, starts now. And so I think that if we were able to say, it's not that I'm excluding or I cannot have these things, which is what you just said, Dr. Garrett-Price, it's what am I going to do as my routine for 80% of the time? And what is that going to look like? And then allowing myself that sometimes I can eat certain things, but our portion size, in North America, and then also the actual content of what's in our food has really been detrimental to our morbidity, mortality, and our life expectancy. So I always think quality over quantity. So what is the quality of life that you would like to have for yourself? And what can I do for those small changes over time to get me that outcome? And that is a lot through nutrition.
Perfect, Dr. Shepard. Thank you. And I want to tag on to that. And I do remember my blood pressure question, so I will ask that at the end of this. But when you mentioned portion size and all of that, I do know that my wife and I, we travel quite a bit, both internationally and north and south of the border. And I've noticed the portion sizes outside of the continental U.S. are extremely larger. They more processed food, more fats, and all that on the plate that you find in the U.S. I mean, when we travel internationally, we find a continental breakfast will be fresh fruits, maybe a few breads, some grains, a well-balanced breakfast. Here, there's a lot of fried eggs, jams, a lot of fats, and all that. And then in the portion size, like I was mentioning last night when we went to the social event and had the chicken wings. The chicken wing portions were huge. They weren't. You could tell they, steroids or some kind of growth hormone. They were these huge turkey leg sized chicken wings, which almost it was shocking when they came to the plate. Now, we finished them all, but the fact that they were so large was shocking. So yeah, all that said, I do agree. Portion size in the U.S. is extremely disproportionate to the rest of the world. All that said, I know we're coming within 7 minutes of closing. I'd like to give both Dr. Shepherd and Dr. Price an opportunity for closing remarks, where you can find them on social media, where they'll be next. If you happen to be in the town or city where they are, you can catch them. All that said, before we do close, I do have my blood pressure question. What is a good blood pressure reading? They always provide you one number over another number, and they'll say, "Oh, that's good. You're doing well." What does that mean? What is a good blood pressure reading?
And I'll take this, and I know Dr. Shepherd will probably say something about this as well. So you have a top number and a bottom number, just so everybody knows. Systolic is when the heart is contracting. Diastole is when it's relaxing. That's the bottom number, the relaxed number. So ideally, the blood pressure should be less than 120 over 80 if everything is optimized, right? So 120 over 80, you want to be in that neighborhood or less. Now, when you start getting over 120 to 130, I say 120 to 130 is a decent range. And then you start to say, okay, 70 to 80s is where I want that bottom number to be. We start getting more concerned when you start getting over 120, but definitely when you get over the 130s and the 140s, technically that is now hypertension. So if you are seeing numbers in the 130s, the 140s, and that bottom number is creeping up over 80, then you definitely want to, first make lifestyle changes, right? We talk about food as medicine. That's probably the truest thing we've said on this call, is that truthfully food is medicine, and you can really divest through lifestyle. And then you start to be more active, as Dr. Shepherd and I have alluded to. We have this saying, 15 minutes a day keeps the heart attack away. And so a lot of people think exercise is unapproachable. Just walking your dog, walking around the building, jump roping, something that's achievable. So in general, you want to be less than 120 over 80. That's optimized. When you're in between 120 and 130 over 70 to 80s, then all right, we got some work to do. But definitely when we get over 130 over 80, I, as a family physician, start to get concerned and start to intervene, maybe pharmacotherapeutically, but less so, but more with your lifestyle, which should be happening across the board. And if you're getting 150s, 160s, 170s, you need to see somebody in the next 1 to 2 days because those numbers are getting high. And there's a reason, especially when we start talking about women and women's health, there's a reason that we call this a silent killer, because a lot of times there are not a lot of warnings. And then definitely when we talk about women, females, the signs and symptoms, and I know Dr. Shepherd can speak to this, are a little less pronounced. So you want to be aware of these numbers for sure.
Yeah, I would co-sign. No, I was just going to co-sign everything he said. And typically, just for the women's health perspective of it, is that for many years they did research on heart disease and hypertension, but they were done on men. And so a lot of times numbers don't correlate with women's health. And also we present differently if we are having some cardiovascular issues, which may not be seen as a typical heart disease feature. And so I say the same thing to my patients, Dr. GP, is that it's a silent killer because it's not this physiologic symptom that you feel with blood pressure until your body then tells you something's wrong. But usually by then, you're very actually advanced in the disease. So the goal really is to get it when it's early, so it's easily controlled. You can do it not necessarily with a pharmacological medication. You can actually use lifestyle factors. But when you do get to those critical levels where you are now having a symptom, whether it's eyes, your kidney, whatever it is, that's when you do need help with medications. Then it is a little bit harder to get you to what we call normotensive, or where we would want your blood pressure to be.
Perfect. We have one last question before we give the floor to you guys to wrap it up. It's in there. It says, would you say?
I see it.
Okay. Yeah. Go ahead.
Yes. So talking about mental health, and I love this question, and we'll both give a quick answer here. Would you say our mental health is loosely or closely connected to our physical health? How does mental health impact the quality of our physical health? Very, quick, short answer is yes. It's very intricately aligned with our physical health. And what we do know is from a mental health and a mental wellness perspective is that we are seeing more of it. But what it does impact is our neurotransmitters, our ability to connect, relate. And then also what we have seen in studies is the impact of exercise and foods that then impact our mood. So a lot of times when people do have issues with mental wellness, I do take it back to what are your foods that you're intaking, and also are you exercising? Because exercising definitely increases your endorphins and your release of dopamine, which is your feel-good neurotransmitter. So they are very closely related, and we do find that people who are actually depressed have more chronic diseases than those who are not. So there is a very strong correlation, which is why in both of our practices, we highly, highly look at mental wellness and giving you the modalities to improve that.
Yeah, I would agree, and I think I said this at our last panel together, is that as the mind goes, the body goes. And just practicing last year's, family doc, you understand that, a lot of times behavior can lead to physical symptoms. So yes, I think these things are one and the same. The body is literally all one thing, right? To Dr. Shepard's point, we see a lot of chronic illnesses who had their origin in someone being depressed or having anxiety. And also when you look at treatment of these conditions and you look at the evidence in the literature, the first treatment is never pharmacotherapy. It's always put better foods in your body, exercise, because we know these things can reduce inflammation and lead to release of positive endorphins. So that's why we made the point very early on that, mental health and physical health are closely connected. They are one and the same. And we have to pay attention to them both and be deliberate in paying attention and treating both because there can be good outcomes and poor outcomes depending on how we approach it, for sure.
Awesome. Perfect. Thank you, Dr. Price. I know we're getting ready to wrap up because we're getting close, and I want to make sure we have plenty of opportunity for Dr. Price and Dr. Shepard to kind of give the closing remarks and also kind of promote what they have going. I know on the front end of the conversation, Dr. Price mentioned he was at Morehouse and has some interesting things going on at Morehouse College there in Atlanta, Georgia. And Dr. Shepard, I'm sure, has several things going on. Be sure I want you guys to find GP Health online. Make sure you find Dr. Shepard at Sanctum Med and Wellness. So I'll give you guys an opportunity for that right now. Thank you.
Yeah, so my closing remarks are essentially to be proactive and preventative in your approach to health. It is less expensive on your time and really your quality of life. That's what you should be going for. My practice is located in Dallas, Texas, in the Design District. It's called GP Health, Proactive Preventative Platform. We are membership-based. Feel free to come see us. Our website, and I can put it in the chat, is drgp.health. If you're interested in joining us, we've had members getting a lot of great results. Certainly send us a message on our site. We are on Instagram. The handle is GP Health. For those who don't know, we're on LinkedIn. I'll have some upcoming appearances. Oddly enough, I'll be in London in January. I think that you will start to see more of us. We're going to be doing some different things with our members and kind of letting them tell their journey. So look for that on our socials. And I'm sure there'll be some other engagements coming up. We're doing some active things here at Morehouse with the health career students. So you'll be seeing that on our Instagram as well. So thanks for letting me be a part of this. And certainly look us up. We are happy to have you in our practice and we'll receive you and you'll get great care for sure.
Yep, I'm co-signing that. And Dr. Shepard?
Yeah, I'm here on Lover's Lane right here in Central Dallas, Sanctum Med and Wellness. We definitely approach health in a different way. We really take the composite of what you get through traditional Chinese medicine we have included here. We also have a registered dietitian And then we also have life coaches in addition to yoga and meditation for that mental health, because we really believe, like Dr. GP said, it is all one system, and we really want people to integrate all of those systems together. And we approach it from a Western med, but also from Eastern modalities and a functional med perspective. So you can find us on Google, Sanctum Med and Wellness, and also on social. We have Instagram, Sanctum Med Wellness. You can find us there. So hope to see you. I think between the two of us, we really have a different approach, and we would hope that people would want to get that info